Well, everyone always asks, what do you want to be when you grow up? If you still don't know the answer to that, consider a career in pharmacy. Northeast Ohio Medical University shares some details on what your pharmaceutical journey could look like in their program. This segment is sponsored by Neomed. Creating leaders in the medical community, Northeast Ohio Medical University is improving and serving the Buckeye State. And here to talk with us all about it, we have Dr. Richard Kasmer, the Dean of the College of Pharmacy at Neomed. How are you doing today?
I'm doing great, Liza. Thanks for your time today.
Absolutely. Thank you so much for joining us. So let's talk about what it takes to become a pharmacist. Obviously, it is no easy task, but let's talk about the educational requirements for it.
Sure, absolutely. There are many paths that lead to a career in pharmacy. And in essence, to be a good pharmacist, what you really have to be is a strong, I'll just say, math science individual. At the undergraduate level, what we see is most of our students come to us from backgrounds in either biology, chemistry, or biochem. Those are the big areas that we work with. In order to complete that task, you have to do at least 2 years of undergraduate work, or at least about 60 credit hours before you can proceed to the professional level.
For sure. And so how do you guys train your pharmacists?
Correct. The path to a pharmacy degree really is a 6-year track. It's at least 2 years in undergrad, followed by 4 years in professional school. When they get to professional school, like Neomed, in essence, what we do is we have a certain amount of time in the classroom, as well as we have required by law a certain amount of experiential hours. At the end of the day, when they do graduate, they've accumulated at least 2,000 of experiential hours, which in our eyes basically makes them practice ready. A key piece of what we do here at Neomed, though, is we're big about interprofessional education, which means what they do is they train right alongside other professional students, say like medical students. And the reason why we do that is they train alongside each other, they learn how to work together, and as a result, when they graduate, they work better as a team.
What career opportunities or practice settings are there for pharmacists?
And that's a great question, because I think a pharmacy degree is a great degree. It's what I would call as a platform degree. And once you've achieved it and have it, you have actually many different ways you can go. There was a book that was written many years ago which talks about the 90 different careers that one can have in the profession of pharmacy. I use myself as just an example, as I am a pharmacist first, a lawyer second. So my area of interest and expertise is actually pharmacy law. The profession of pharmacy is highly regulated. We deal with over-the-counter drugs, dangerous drugs, controlled substances. There's an awful lot of laws and rules that actually control what it is we do in terms of our daily practice. So having somebody who has that level of knowledge and skill is really important. In addition, there's many new opportunities that develop literally every day. Just say within the last 10 years, we deal with now more specialty medications than we did 10 years ago. Things like Humira, Stelara, and a whole bunch of other products. Things like precision medicine, genomics, and I think as time goes on, many more will actually come to the surface.
So what does the future hold for the practice of pharmacy, and where does the Neomed College of Pharmacy fit into that?
One of the areas that we've been focusing on here at Neomed is really creating transformational leaders, identifying high quality students, giving them a professional degree, and then they go out and do great things in our community. I'll give you a real live example. One of the things which is really big in Ohio is provider status. We as pharmacists have a great knowledge base. We're the medication experts. But one of the things that we want to do is be more provider based. So for instance, we now today do a lot of immunizations. We do a lot of diabetes care, a lot of working in hypertension clinics, lipid clinics, asthma clinics. We really are very deeply involved with provision of care. It's closely within our area of expertise. It's handling and managing medications, but I think you're going to see that really be the wave of the future. You're going to see us get more deeply involved in those specific areas.
For sure. Well, thank you so much for sharing all of this information and for joining us today.
I appreciate it, Liza. Thank you very much.
Absolutely. And this segment is sponsored by Neomed. If you're interested in becoming a pharmacist, the contact information for Neomed is right there on your screen. We've got their address, their email, their phone number, so be sure to check them out.